Now with a report on how new technology is discovering prenatal risk for the baby and mother, here's Laura Windsor.
Having a healthy baby is a priority for every mother, and with new advances in prenatal diagnosis, doctors now have the advantage in early detection of any health issues that may arise. Dr. Patricia Faraz of Mission Hospital in Mission Viejo explains the diagnostic process.
I trained in Chicago, and I was lucky enough to have some of my training by the physicians at Northwestern University who were involved in the investigation of the newest screening methods that are available now, and that's first trimester ultrasound and nuchal translucency. So what the perinatologists do now is that they measure the thickness behind the fetus's neck, and it's typically done between 11 to 14 weeks. It has a high correlation with Down syndrome and other congenital defects, heart defects, spine defects. In addition to that, they undergo a simple blood test and genetic counseling, and they're given a risk assessment. So if, for example, someone was 31 years old and their risk of having a child with Down syndrome just due to their age was 1 in 500, they could undergo this test and be reassured that your risks are now 1 in 5,500. Very reassuring, not invasive, especially for women over 35. Many of them are now choosing to not proceed with the amniocentesis, which carries a small risk of miscarriage and infection. And to many women over age 35 who are having their first child, they don't want to take even the smallest risk. So the recent advances are very exciting because they're non-invasive. Women are able to have results earlier in the pregnancy and make decisions earlier in the pregnancy if they choose to. Prenatal diagnosis was basically reserved for women over age 35 or women who have had a previous poor outcome, high-risk pregnancies in the past. But what has recently been recommended is that these tests be available to all women of all age groups. Anyone who's presenting for prenatal care before their first trimester can be offered these tests, which I think is wonderful because many people want the testing to be done. They want reassurance that their child is okay. They want to know that things are going well. And we can now offer that with a non-invasive test and a simple blood test. So I think that's exciting. The American College of Obstetrics and Gynecology, which is recommending that all women be offered first trimester screen, ultrasound, blood work, whereas before it was only women over age 35 or age 35 at the time of delivery. I think absolutely women who will be age 35 at time of delivery should absolutely 100% have these tests done. But I think anyone who has what standard of care available to them should be offered these tests. We're lucky. I'm in a wonderful hospital that has great perinatologists. They're very up to date. They are performing all the counseling. They are doing the tests. So I'm very lucky that I can offer these tests to my patients. But I'm sure that an hour away from here, these tests are not necessarily available, or people have to travel to get somewhere where they can have the testing done.
Prenatal care and working with the doctor is vital to help ensure the best outcome for the mother and her baby. For the American Health Journal, I'm Laura Windsor.